Unfortunately, sugar creates a depression in this orexin. It will make you more sleepy, less wanting to move. It has a negative effect. And one of the problems, if you take away your bite, if you move your bite by putting in a night guard that you don't need, you could be causing a bite dysfunction. You could be actually taking away the benefits of biting your teeth together. Have you just spent $600 on a night guard? Because if you have, I'm sorry. I want to talk about tooth grinding. I know you think you grind your teeth, and there certainly are situations where a night guard can be helpful. But I want to do a much deeper dive on this whole problem, because years ago it was suggested that 1/3 of the population of America grinds their teeth. During COVID, the American Dental Association said that that number jumped 70%. And I'm not good at numbers, but that means more than half of the population right now are struggling with a problem called grinding their teeth. And as a dentist and I do care very much about my patients' mouth health. I was thinking the other day, and I'm trying to think back, I don't think I have ever made a night guard for anyone except perhaps a couple of patients for temporomandibular TMJ dysfunction, but not because they grind their teeth. I grind my teeth. I have all the symptoms. I have the worn surfaces. I have the different anatomy that comes when you've ground your teeth. There's something called abfraction, which is when, as you grind your teeth, they bend and tweak, and little bits of enamel come off the side of your teeth, and you have a groove at the gum line, usually along the back molar teeth. These are the symptoms that make your dentist suggest, would you like to pay for a night guard? I'm going to suggest you look at this problem diving underneath the symptoms. Yes, you can wear a night guard, and in a minute I'm going to tell you why I would suggest you don't. But first of all, if you grind your teeth, what usually happens? You'll grind your teeth. You may, as I say, get this groove at the gum line of your top and lower molar teeth. That's the place you most often see it. You may have been blamed for brushing the wrong way, but an astute dentist will know the difference of this abfraction rather than abrasion. The other things you may get are chipped teeth, cracked teeth. If you have implants, they can break. You will see surface disappearing. These are serious oral health problems. I'm not underestimating that, but I am saying that most of the time, these problems are purely symptoms that you can do something about without having a night guard or a bite plate. The other interesting thing is that statistics show that grinding teeth occurs in women 5 times more than in men. So that in itself is a very interesting statistic. And I would say it clarifies what I'm about to say, that the majority of cases, you do not have a serious grinding problem that's called bruxism. There is a percentage of people who maybe do. But the majority of people, and particularly if you're a woman, let's look at the other underlying causes why your teeth would be wearing away. See, when we grind our teeth together, and I mentioned that I grind my teeth, but I don't do anything about it. Why? Because I learned 50 years ago that the reason I had damage was because I was on a grapefruit diet. I was eating grapefruits before I went to bed at night. If you're a woman, you probably have acidic saliva. Definitely if you're pregnant, or if you're going through menopause, or if you're stressed, or if you have a dry mouth. That's the other thing that will make the damage in your mouth worse. Because if you have acidic saliva, it softens, it pulls minerals from your teeth and makes these really strong, wonderful things we call teeth really into a soft and squodgy, easily abraded kind of putty. They are so soft, if you have acidic saliva while you're pregnant, that they will easily be worn away just by grinding against each other. If your tooth enamel is truly healthy and hard and mineralized, there's no way that grinding your teeth is going to wear them away. At least not unless you have a serious problem that we will call bruxism and get into in a minute. So don't assume you have that problem first. Look at, test, get a pH testing strip, look at your saliva, see how acidic it is. Don't panic. Xylitol and my complete mouth care system will help you overcome acidic saliva and also help you overcome if you have dry mouth. Maybe at night you sleep with your mouth open. Maybe you have medications that you take for allergies, or maybe you have heart problems and you're taking medications. The side effect is that it dries your mouth. All of these things that contribute to acidity or dry mouth are going to make your teeth soft and vulnerable to wearing away. And the solution is not putting in a night guard. The solution is try to control the acidity, try to strengthen your teeth, try to make your enamel so strong that it will not wear away. I have now been 50 years grinding my teeth without any more damage. The damage that was done in my 20s is still there. But it stopped the minute I knew how to look after my teeth. And that's why we need to teach our children young enough, before they go to college, before they get stressed out, particularly if they're girls, before they're pregnant. And then they won't do this damage that they didn't know they were doing. I had no idea the damage I was doing to my teeth on my crazy grapefruit diet. The other thing that's equally problematic and almost as bad as a grapefruit diet is if you have acid reflux. If you have acid reflux, that stomach acid in your mouth is going to soften your teeth and make it so that when you're asleep at night and grinding your teeth, which we all do, your teeth may grind away. The other thing that damages teeth are mouth care products. If you're somebody who rinses your mouth with Listerine before you go to bed at night, you will have acidity. Listerine is very acidic, has a pH of 4.2, which is why it is a part of my complete mouth care system, but it is not the final rinse. If you go to bed and drink alcohol before you go to sleep at night, you're going to dry your mouth. You're going to have more tooth grinding problems. If you smoke tobacco, if you smoke any kind of tobacco or cigarettes, you are going to have more dry mouth, more possibility of grinding your teeth away. And it is preventable. This is preventable. So why wouldn't you just have a night guard? And this gets into a little bit of science, so bear with me. Because when we grind our teeth, when we bite together, there is a natural response. The place that holds your tooth into the jaw, the tooth is held into the jaw by something called the periodontal ligament. It's actually lots of little hairs that attach the tooth to the jawbone. And when these hairs feel pressure, they send a message to your brain. And your brain produces this enzyme called Orexin, or it's a little product that the brain produces. And Orexin has various effects on other parts of your body. It's actually a response to stress by the body. If you were suddenly woken up from sleep by some stressful predator, this Orexin would kick into gear to make your vision more focused so you could see better. It would raise your blood pressure to give you the energy to get going. It would actually make your heart rate faster. It would make your heart beat faster, so your blood will be flowing, so you'll be able to move and jump around better. And so Orexin is really the response to stress. It's our awake response. It's being awake, alert. It gives us spatial. We know where we are in balance and in space. It's a wonderful natural response that we have at our disposal when we're aroused from sleep quickly. And the trouble is that when this gets out of balance, and that is where this dovetails with bruxism. And that dovetails with when you are sleeping and you have some sort of airway obstruction. If you're sleeping and your tongue falls back into the throat, it sends a stress signal, and this sends a signal for the same orexin to wake you up and get you going and raise your heart rate and raise your blood pressure and put you in an alert state because, hey, you're about to suffocate yourself. So there is this stress response when you don't breathe properly. It's called sleep apnea. And it is very tied into this stress response and to orexin. Now, that being said, when you bite your teeth together, every time we bite our teeth together, it helps send this signal that keeps us awake. If you have no cells responsive to orexin, if you cannot make orexin, for example, you will have narcolepsy. You will be falling asleep all the time. Unfortunately, sugar creates a depression in this orexin. It will make you more sleepy, less wanting to move. It has a negative effect. And one of the problems, if you take away your bite, if you move your bite by putting in a night guard that you don't need, you could be causing a bite dysfunction. You could be actually taking away the benefits of biting your teeth together, because one of the benefits, and you can ask anyone who works with special needs children, chewing and biting has been shown in many studies to help cognition. It helps us think better, keeps us awake, keeps us focused, keeps us alert. This is this orexin response. And if we mess with it and take it away, and this is one of the things I think how it works if you have had all your teeth removed and you have no teeth to bite on anymore, you are at more risk for dementia, for more risk for cognitive decline. It is a fact, I'm sorry, but it is a fact, and this is a good reason to hang on to your teeth. And I'm not sure, I don't know if we have studies whether implants create the same response as the periodontal ligament, because there is no periodontal ligament with an implant, which is one of the reasons, until I know more, I don't usually recommend taking out a tooth to have an implant. I would rather that you have a tooth there that is sending these signals to help improve your cognitive function. So that being said, why am I against night guards? Because I don't know if they may not make you feel potentially more sleepy. Maybe they interrupt this circle of orexin stimulation that we need to be awake, to be alert, to know where we are, and to function well. So why not try, first of all, everything you can to avoid having a night guard? It'll save you $600 for a start. And you may be able to do that by improving your mouth care routine. And of course, I'm going to recommend the products that I recommend in my complete mouth care system and xylitol to strengthen your enamel. I'm also going to recommend that you look into things that you can do easily before bed so that you sleep more soundly. You know, turn off the devices, darken the room, you know, music if that's what you like, meditation, anything, whatever it might be that will help you to sleep more soundly, to be less stressed. And then there are things that I believe are very useful if you're stressed. Magnesium has been shown to be very helpful. And there are foods. I'm not big into taking a lot of supplements, particularly magnesium, calcium, and phosphorus supplements, because they have to be balanced so perfectly. But if you take foods, good foods that have lots of magnesium in them, then this can be helpful. Almonds, dark chocolate, there are eggs, tofu, there are bananas, there are lots of things. You can just do a Google search for foods that improve magnesium levels. The other thing I highly recommend, particularly if you're getting headaches from this grinding, that's one of the problems many women complain about. They get temporomandibular joint dysfunction. They find they ache at their jaw. They also get headaches. Think about taking some low-dose melatonin. That would be a supplement that's very gentle, or just to add more foods that will give you more melatonin. This would be salmon, there are grapes, there are mushrooms are wonderful food for more melatonin. Tomatoes, whole milk, oats, there are a number. Do again a Google search for foods that contain melatonin. And you can do many of these things. Try it for a month or two. If you see improvement, I would say to you, go down those avenues, and I would highly recommend avoiding changing your bite with an unnecessary night guard. The other problem with these unnecessary night guards that I have noticed is that they can actually cause gum recession. And if you're noticing your gums receding, particularly around the teeth you bite on, your lower teeth perhaps, you may want to take out that night guard and see if you can do gum massage using the brushes that I recommend and the techniques I recommend, and see if by removing the night guard, you can reverse the gum recession. You have to do your own experiment, because at this point, I don't think anyone is looking. And I would recommend that you do. Now, that said, there probably are 15 to 20% of people that may have a serious bruxism problem. And if you're one of those, you are apparently biting 6 times more firmly than the 200 pounds of pressure that is normally put on our teeth when we bite together. So you're putting incredible pressure. This is when people talk about things completely breaking in their jaws. Often is associated with stress. So don't forget the melatonin and the magnesium, but you may also need to go and see an airway specialist, a sleep specialist who can help you. So I think putting it all together would be what I would recommend, realizing that there's still maybe 20% of people who do need real expert help. But don't just fit yourself with a night guard because somebody told you you grind your teeth. We all do. What we need is teeth that are strong enough to withstand that and enjoy the cognitive improvement we can get from biting our teeth together.